Alright everybody, so today we are going over my everyday carry kit. The base of it is the Medi Hawk style or Hawk type rip away bag, and then I have a simple Molly pouch here, as well as a Molly attachable tourniquet holder here. And on the in the tourniquet holder, I have a SAM soft tourniquet here, and in the back of the tourniquet holder, if I repack this here, in the back here, there's a spot to put trauma shears, and I will usually have my X shears back there, or I might have the tactical holster for the X shear attached here. Currently working on getting the new X shear holster, which is called the micro holster. It's just real easy, and it should just be able to clip right in here and clip right on. The only reason why I sometimes put the extras in here is because the holster I have is very hard to take on and off of that molly attachment, so that's why I tend to not use that one as much. A simple US flag patch, got the Medi patch over here. I have a molly clip over here, and we're gonna start off with, we're gonna work from the outside to the inside. So we talked about the tourniquet holder, now we're gonna talk about my trauma kit here, which is just mollied to the outside. Get this down here. So we're going to talk about our trauma kit here. So it has RIT, which stands for Rapid Intervention Team, and trauma kit. Now, mind you, most people say to keep your tourniquet and your trauma supplies outside of your main kit. I do agree with that. I do have my tourniquet and trauma shears outside of the kit, but this is a completely self-sustained trauma kit, so this has everything in it to treat any trauma emergency. So, starting off here, we have a simple, I think this is like a Gen 5 cat tourniquet. Here we have a simple tape, some glucose gel for diabetic emergencies, 2 chest seals. These are the Ever Ready brand. They came with my larger kit, and I'm currently working on getting the hyphen chest seals to put in here. We have Celox gauze, Seafold hemostatic, and then we have Quick Clot non-hemostatic gauze. We have a nasal geopharing airway with the lubricant in there, and this is a 28 franc size. We have S-rolled gauze, combat gauze, responder gauze is another word for it too. Basically just gauze for wound packing. My Medic emergency pressure bandage 6-inch. So this can be used for a wound that needs pressure applied but can't apply a tourniquet to it, such as abdominal wounds, head injuries, stuff like that. We have trauma shears. These are just a cheap pair that came with the bigger kit as well. A pen light for pupil dilation, as well as a tube of saline here. Ooh, a little wrinkle there. We have a assortment of non-stick pads here. So we have 2x3 here, 3x3, 3x4, 4x4. We have a survival blanket here, and we have, I don't know if you can see in there, I think there's 2 sets of gloves in here. And now, another thing for the trauma kit, most people say that you should have a more recognizable, more flashy, I guess you could say, kit for trauma, so that people know that don't mistake it for something else. They know, hey, this is a first aid kit, this is a trauma kit. I am working on getting a different pouch to put on here, to make it more visible, I guess, because this just says trauma kit and has RIT on there, or RAT, but it's not. If I took that off, you wouldn't know that it's a trauma kit. But yeah. Now moving on to the large kit itself, I already talked about the tourniquet holster on the top here. Not much going to talk about the kit itself, like the bag itself, because I did do a full video on the bag itself and how it comes from the factory. But we're going to talk about how I have customized it in here. So we're going to start with this one and go to this one. Now, most people would look at this and say it's pretty organized, but pretty unorganized. To me, it's not. I know where everything is, but I've tried to put labels here so that people can know where it is if somebody else has operated out of here. So here I have my fracture stuff. I have a simple finger splint here from my medic, as well as the triangular bandage here, and these are rubber banded together. And in here I have 3 saline washes here for washing out the eye or wound. I do have a chem light here, glow stick. Chem light just sounds cooler. With a string here. You don't have to include a string with it. I like to have the string in case I need to hang it, attach it to anything for any particular reason. I have the ability to do so. And yeah, it does get in the way sometimes, but all you can do, or all you need to do, is just wrap this up here. Moving up here, we have my wrist blood pressure cuff by Care Touch here. Simple little blood pressure cuff here, simple for carrying in kits like this. You just attach it to the wrist here, you tighten that up, and then you go like this. You put it to your heart and it will we'll start checking your blood pressure here. And obviously it's not going to get an accurate reading because I don't have it by my heart here. I have it. Oh, but to demonstrate how it works here. And it does check pulse here, so you can see 110 beats per minute, and then blood pressure. And that is in its own separate thing here, and I will leave a link to all of this down below. Ever ready emergency whistle here, pretty basic item there. Cloth tape, another NPA or nasal geopharyngeal airway with lubricant taped in there. We have under here all my paperwork. So we have this, which is a list of everything and all the medications that's in here. So it's inventory. You can see the inventory there, and then at the bottom, here you can see all the stuff there, all the different medications, and I can keep track of it, whether it's expired, everything like that. And then my point of care notepad here. And we have date, time, location, patient, whatever of whatever. So if you have multiple patients, 1 of 4, 2 of 4, so on and so forth. Age, you have your name, the patient's name, the male or female, chief complaint, medical conditions if they have any, medications or allergies. You have your vitals here, blood pressures, heart rate, resting rate, temperature, SpO2, heart and lung sounds, pupils, LOC, GCS, your assessment, the plan, vital signs progress, medicine progress, and just some notes there. This is good to have as a paramedic or an EMT working on an ambulance or a medical vehicle to know what has happened, to keep track of what have been given to the patient. It is also good, in my opinion, for a civilian if you have performed prolonged care to a patient. You can give that to whoever you're passing off to, and they are able to know if you've administered any medication or all the stuff that you've received from the patient themselves. Now, I did have a discussion, or there was a discussion done on a previous video about whether having vital signs and giving it to a medical crew when passing off from a civilian to a medical crew. And some people said, they won't care about it because they're going to take their own vitals. It's still good to have it because they can see the progression from the time that you've taken your vitals to the time that they've taken their vitals. And it helps them to be able to have that progression of those vital signs there. And last but not least, we just have our MyMedic splint here, also compatible to a SAM splint for arm, leg, ankle, wrist, or sorry, not wrist, arm, leg, ankle, knee fractures, anything like that. Any limb fractures, really. A little hard to stuff back in here, but once it's used, it's obviously not going to be put back in. So, put our NTA back in here. Okay. Here we just have a secondary thing for secondary trauma here. A thing of responder gauze here, just as a backup, or something to refill the trauma kit in the event that I need to. And also, if someone else is using the self-contained trauma kit and I come across a trauma emergency, such as a mass casualty scenario, I can provide trauma care with that. one to go in there. There we go. Over here we have some hemostatic granules. So it's just powder that you pour on a wound, and it will it has that hemostatic agent which will help that bleeding stop, as well as two barf bags right here. Over here it's a little messy. We got all of our tools. So we have disposable plastic tweezers, metal tweezers, straight forceps, scissors, bandage scissors, and two different pen lights. We have this one that came with the main kit, and this one that I got from my Medicare. So I got a softer light here versus a more white light or fluorescent light there. Moving down here, we have our stethoscope for checking heart and lung sounds. We have a pair of gloves. I believe we have more pairs of gloves in here. Yeah, so 1, 2, 3, 4 sets of gloves in there. We have 2 instant cold packs here. One and maybe just one. Well, I guess only one cold pack in here. We'll have an instant cold pack in here. And then taking kind of all of this out here, we have all of our non-stick pads here, same as in the trauma kit, 2x3s, 3x4s, 3x3s, 4x4s here, as well as our KN95s masks here. And then the last thing on this top row is the CPR mask, which I took out first. So this is an adult and infant CPR respirator mask by EverReady First Aid. And in here you have instructions for use. If you're carrying this, just like tourniquets, I would recommend knowing how to use it if you're carrying it, instead of trying to read that as instructions in an emergency. We have basic pair of gloves in here. Tools and alcohol prep pad to prep the surface before you use the mask. And then in the mask itself, we have the pre-set up, or sorry, not pre-set up, but we have the infant one that has this air cushion here. And then this one is hard plastic with then our filter here that goes on here. To blow into here keeps anything from going back up to you. So with infants, it basically just helps to get that seal so that the air is going in, because you're not really worrying about infants overdosing or something like that. But for adults, you have your filter that goes in here. Maybe. There we go. You have your filter that goes in here, and that is supposed to keep anything from going from the patient's mouth into your mouth, such as vomit, blood, or anything that comes back up. Or if the patient has come in contact with anything or has overdosed, it stops any of those effects from coming to you when you use this filter. I think I had those filters backwards, actually. Yeah, I had the filters backwards. Okay. But so you have your filter in your mask for the infant and your filter in your mask for the adult. And then it has this thing that goes around the patient's head for the adult mask that I use to keep all that in there. And just put it back in there. And it has on the back here a strap so you can attach it to the outside of the kit. It also has a clip that you can attach it to. Most commonly, you'll see this on the belts of lifeguards or in the kits of lifeguards, because it's easy to carry this and to be able to use it in a cardiac arrest or drowning scenario. Alright, so now if we look at the other side here, you can see we have my pouch here that's titled medications. It is attached by Molly straps into these straps right here, so these just go through there. And this is a Badlands drop pouch for shotgun shells, but I use it as my medication pouch. So that's not how I usually have it aligned, but I have taken this out to use it for something, so that's why this is like this. So we have our basic medications, there are OTC meds in here. We have antacid, motion sickness, diphenhydramine for cold, sinus decongestant, ibuprofen, and non-aspirin. We have another allergy relief, just basically a bigger bottle of diphenhydramine. Painkillers, ibuprofen, 200 milligrams. Pepto-Bismol chewables. Another Transcend glucose gel like we saw in the trauma kit. Sting kill swabs, so you break the inner tube and you shake it up and it will soak the swab with the liquid, and you put that on a sting and it's supposed to help with that. Now, this is not a thing about this. When I looked at the reviews, people were thinking of it as an EpiPen. This is not a solution to an EpiPen. If you are allergic to insects or insect stings, do get an EpiPen and carry that with you. Do not try to use this as a solution for that. This is for people who have a minor allergy, maybe. If you don't need an EpiPen for the allergy, or just for people who don't have an allergy who just get a sting and need this to bring down the inflammation. And then we have 4 different bottles here, 2 of each. So here we have hydrogen peroxide and hydrogen peroxide. This label's a little worn there, but 2 hydrogen peroxides there, and 2 isopropyl alcohol, both for cleaning wounds. And we'll just flop that over there. And repack this here. like I said, this uses these bands right here that buckle into this, and they sit right into these guys right here. So if the kit flips over, that's like me falling out, and I can still take the bag out itself, or I can unzip it in here and get the stuff out. In here we have 2 empty bottles in case I need to collect any specimens of any sorts. We have a multi-combine dressing here, as well as this, which is mainly used for pediatric patients, as you can tell by the word kids. It's the Band-Aid brand antiseptic cleaning foam. Basically like the same thing that isopropyl alcohol will do, but without stinging the wound. Why it's used for mainly pediatric patients. Another rescue blanket here, and 2 ace wraps, 4-inch and 2-inch, I believe, and then a 3-inch thing of self-adherent bandage there. And then this skin repair bottle here, which is a antimicrobial thing or antibiotic cream here. So that'll be used for your cuts, scrapes, minor wound care stuff here. Speaking of minor wound care, the next thing we have up are these 2 wings that come out here, and you can see this says, come up a little bit, but you can tell this one says minor wound care and this one says miscellaneous bandages. So in here we have just a simple bottle of H2O to pour on a wound. You didn't know H2O stands for water. We have hydrocortisone cream, triple antibiotic ointment, like that skin repair tube that we had. Liquid skin tubes here. These are basically a medical version of super glue. So you can use this to hold a wound shut. They're basically liquid stitches. But definitely if you're going to use these, definitely you need to go to a higher level of care, such as a hospital or ER, to get stitches themselves. And then in here we have itch cream from Benadryl and another triple antibiotic cream. Syringe for flushing. Another saline tube. Hydrogen peroxide here. And the reason why I have hydrogen peroxide, water, and saline in here, even though I have hydrogen peroxide in the medications and you can see saline through here, is because in here, it's a minor wound care kit. So instead of grabbing things from throughout the kit, I want to be able to just grab this and be able to throw it to somebody or hand it to someone and they can use this, or I can just take this out and use it without having to carry the whole kit with me. Next up we have 2 That's It bars, just a little food in case someone needs to take it with a medication, or something like that. We have some Burn Shield Sterile Trauma Hydrogel, also known as burn gel here. Now I would not recommend using this over a large portion of your body if you do have a large portion of your body burned, or if you have 2nd, 3rd degree burns, or some 1st degree burns. Definitely need to call 911 and be taken to a burn center. This are mainly for small burns. You know, you touched the burner on accident, you touched a hot pot on accident, and just put this on your finger with a band-aid and you're good to go. By no means is this meant for large-scale burns. Next thing here we have antiseptic towelettes, BZK antiseptic towelettes, iodine prep pads, alcohol prep pads, sting relief wipes, and some more burn gel, this time from my Medi here. I'm going to repack this real quick. And see, this just velcros right in here. So if I want to use it attached to the full kit, I can just open this, flop this open, and use it, or I can detach it itself and use it as a separate kit. Miscellaneous bandages kind of speaks for itself. We just have a group of equate little bandages there. More gloves. 1, 2, I guess just 2. So up to 4, 5, 6, 7, 8. Up to 8 people can work out of this kits with gloves. Or if you know they tear, you can always get a replacement set of gloves. In here, again, just miscellaneous bandages. We have some butterfly bandages here, some specialty bandages like knuckle bandages, fingertip bandages, knee bandages, and then you have your basic ones here, your smaller ones there. Comfort stretch gauze here. We have 2-inch, 3-inch, 2-inch, 3-inch, 4-inch, and also it's not in the kit, but the trauma kit does. I do put in the trauma kit a 3-inch, I believe, comfort gauze in there as well. And then in here we have more miscellaneous bandages. We have our smaller, mainly this is our smaller sterile gauze pads or non-stick pads. So we have our 2x2s and our, what is this? Oh, our iPads here. Here we have what are known as steri strips. So steri strips are kind of like liquid skin, in the sense that they are not a replacement, but something that you can use if you can't access stitches. So let's say you're in the woods on the camping trip, you get a large laceration. You can push the wound closed, obviously first sterilize it and treat the wound, then push it closed, and you can use these as stitches to hold that closed, and it sticks to the skin. Again, like I said with the liquid skin, if you are using these, if you do feel that you're in the situation and you do use these, or you're in a situation where you feel you need to use these, definitely afterwards, don't just go home and act like nothing happened. You will need to go, or it is advised, to go to an ER and get that laceration checked out and get actual stitches on there. And in here we have some stuff from our old kit, just some miscellaneous bandages here. Just these two and this one. I'm just going to reattach this here. As you can see here, it is a little hard to zip up just because of just because of the stuff I have in it. But if you get it and you keep it the way it came from the manufacturer, it's pretty easy to zip up. You just pull that over, and on the back it does have this carry sling, and then there's also another panel that you can put on here, and it velcros to this, and it has a MOLLE panel on the back, or it has MOLLE attachment on the back, so you can attach it to a MOLLE panel. And then it has obviously a strap that will come over here and hold this to that. But that is my everyday carry kit. Another thing that's not on here is the outside of this tourniquet holster. Right here, these two tabs here, and these two tabs here. On one side, I usually have a Sharpie, and on the other side, I usually have another chem light here. So if I am carrying this on my person, this tourniquet holster on my person, I will have a Sharpie to be able to mark that time, and I will have a chem light to do signaling, triage, whatever I need to use it for. And with that, that's going to be the end of our video. So thank you for watching. I will have a link for all of this, everything here in the description of the video. I will also be including in the description a link to our merch, and if you want to support the channel, we do have our project expansion going on right now. So if you go on to the channel description, you will see a Google Excel page that has the different things that we are looking for if you're interested in purchasing or donating to the channel for any of those reasons. Reach out to the email that's in the description of the channel, and I'll also put it in the description of this video, and we would be more than happy to receive that donation. So with that, we're going to end the video. Remember, everybody, stay safe and stay prepared.